With far fewer people going to the hospital and vaccine getting into many people's arms, the outlook is brighter than at any time during the coronavirus pandemic. But, as shutdown-weary Southern Californians welcome the reopening of schools, gyms and movie theaters and the return of indoor dining, experts say there is a strong chance the region will see yet another spike in hospitalizations and deaths. And they say it is crucial for people to stay vigilant, wearing face coverings, maintaining a safe distance from others and avoiding crowds, and to make plans to get coronavirus shots. "We're getting there," said Dr. Russell Buhr, a pulmonary and critical care doctor who cares for patients at Ronald Reagan UCLA Medical Center and other hospitals. "We're making good progress." More than 3 million doses of vaccine have been administered in Los Angeles County and more than 1 million in Orange County. In the Inland Empire, more than 700,000 doses have been injected in the arms of Riverside County residents and more than 500,000 have been given to San Bernardino County residents. But until roughly 70% to 80% of the population is immune to the virus, either as a result of getting a shot or having recovered from COVID-19, the threat of another surge will persist, Buhr said. And millions more will need to get vaccinated before the region reaches that point, he said in a Thursday, March 18, interview. Dr. Troy Pennington, an emergency room physician at the San Bernardino County-run Arrowhead Regional Medical Center in Colton, said the region essentially is in a race between the variants and the vaccines. "In short, it's not time to celebrate. We shouldn't be doing an end zone dance," said Andrew Noymer, an epidemiologist at UC Irvine's program in public health. Hospitalizations peaked in early January. LA County's worst day was January 5, when there were 8,098 people hospitalized with confirmed virus cases. Orange County peaked on January 7 with 259 and San Bernardino County on January 5 with 785. Riverside County reported a maximum of 671 COVID-19 patients January 8 and 10. Then things finally turned around and the number of patients being treated started falling. By the end of February, the region's hospitals were reporting about 30% fewer patients each day than they had 1 week prior. The numbers are still dropping. But since the beginning of March, the pace has slowed down quite a bit. On Thursday, the most recent day for which numbers were available, there were about 17% fewer patients in hospitals than there were a week before that. As far as hospitalizations have plunged, down about 90% from the January peak, they're still not back to the lowest levels seen during the fall. On Thursday, there were 380 people with confirmed cases hospitalized in the 4 counties. That's 225 more, or 23% more, than at the lowest point in September. By county, the totals were 827 in Los Angeles, 206 in Orange, 175 in Riverside and 172 in San Bernardino.